The first question tonight is, Doc, why is there fluid in my knee? Why is there synovial fluid? And the answer is, it can be many things. It can be arthritis. So more common arthritis can be osteoarthritis, rheumatoid arthritis. We have gouty arthritis or uric acid arthritis. And we also have in the Philippines a group of hemophiliac arthritis. And you can also have fluid in the knee when you have trauma to the ligaments, ACL tears. If trauma to the meniscus can also cause yung fluid inside the knee po. So, what we do when there's fluid inside the knee, it can cause severe pain. Just the other day, I was in the emergency room. A 6'5" American who was about 190 kilos had severe pain in the knee. He was really in pain. He was shouting at everyone because when there is so much fluid in the knee, it can cause severe pain. The normal fluid in the knee is about 5 cc, 5 to 7 cc, but the fluid I aspirated from that guy was about 70 cc of fluid, and once we aspirate that fluid, there is a lot of pain relief po from these patients. One of the causes is osteoarthritis, and I'm showing you a normal knee on one side, very clean, very white, versus osteoarthritis on the other side. When osteoarthritis is severe, there is bone on bone, and you can just imagine how painful it is. I tell my patients it's like having a car wheel without any rubber running on the street. Imagine, yung gulong ng kotse, wala ng goma, tapos nasa kalsada. Very, very painful. Of course, it bleeds. And yes, it causes a lot of fluid inside the knee. That is one of the causes. Another is gout. When you have high levels of uric acid, when you have gouty arthritis, it cannot be excreted by the body. So when you can't excrete outside the body, the fluid accumulates, the crystals accumulate inside your knee. First, it's the small joints like the big toe, but then after the big toe, it goes to the bigger joints like the knee. And that is when the gout is uncontrolled. It causes on and off knee pain, knee swelling. Again, just aspirating the fluid and putting in some medicine will give that patient a lot of pain relief po. So that is another cause of fluid in the knee. Osteoarthritis, gouty arthritis, hemophiliac causes bleeding inside the knee because you lack certain factors in the blood po. And when you lack these factors, the knee can bleed with minor trauma. Again, aspirating or getting that fluid outside the knee, you get a lot of pain relief po. Rheumatoid arthritis is another common arthritis here in the Philippines. Some patients are very young, yung tinatawag na juvenile rheumatoid arthritis. Bata pa sila tapos they already have arthritis inside the knee. In rheumatoid arthritis, there is a different reason for the arthritis. The body is attacking the joint. It senses that the joint is a foreign body. Parang foreign body yung joint. It's like a bacteria that the body needs to excrete this foreign body. It tries to eat it up and destroy the joint. And again, this causes, the destruction of the joint causes a lot of fluid. We aspirate this. And again, there's a lot of pain relief just by removing the fluid. So osteoarthritis, gouty arthritis, rheumatoid arthritis, bleeding from hemophilia, and trauma from meniscal tears can also cause fluid in the knee. Ito yung usually fluid in the back of the knee, causing cysts in the back. They can also be very painful. So trauma to the meniscus. The meniscus is the shock absorber of the joint. We will talk about it more after this po. But ligaments, yung mga litid po inside the knee, if ma-tear sila, again, that's a lot of fluid that accumulates. Most of this fluid is blood mixed with synovial fluid. So when we aspirate these, we can see a lot of blood from these injuries. And one of the more famous basketball players, si Klay Thompson, also had a ligament tear in his knee and he was treated. It's not always arthritis. Remember, pwedeng arthritis, pwede ding trauma makakos ng fluid inside the knee. The fluid can be synovial fluid and it can also be uric acid crystals, and arthritis po. There is a question from the chat. Doc, does fluid inside the knee need surgery? It really depends. It's a case-to-case basis. What is the cause of the fluid? That is why you must always consult the doctor. And when I say consult the doctor, it's a face-to-face physical examination. We get tests like the x-rays, minimal examination requirement po yan. Face-to-face physical examination, which is why I no longer do yung mga online consultation because I can't do a face-to-face physical examination of the knee. Yan kasi for me is number one. So, I hope that was helpful. Again, if you are not part of the Hip and Knee Arthritis Philippines Facebook group, it's a public group. It's free to join. Join us, and we have a general chat group where you can ask questions about your knee, about arthritis, about injuries. There's another group as well. Or you can see me in the clinic in 401 Robinson Cyber.